Welcome and good night, Trinidad and Tobago, to our fifth show of Psychology Live. Before we get into the show and I introduce my guests, let me give you some links to follow us on Facebook, facebook.com/OurTV4 and gisltd.tt/TV-4, where you can follow us live streaming if you are watching us from the diaspora or online. You can also get us at 675-8747 and 675-8749 when we open the lines after our first segment so that you can call in. I'm very privileged tonight to have three heavyweights in the mental health and clinical field of psychology and psychiatry in Trinidad and Tobago. To my left is Dr. Varma Dayal Singh, who is a doctor, psychiatrist, and secretary of the Association of Psychiatrists of Trinidad and Tobago, and he is he's very familiar with promoting psychiatry and mental health in Trinidad and Tobago. And to his left is Dr. Stafford Pierre, again, an MD psychiatrist, psychotherapist, and a psychosocial rehabilitation specialist. And you'll get to that later on in the show. And to Dr. Pierre's left is, and facing me, is Dr. Peter Weller, who is a clinical psychologist, lecturer, clinical supervisor at Mount Hope Graduate Psychology Program, and he's also chairman of the Caribbean Male Action Network. All right, so we are talking tonight about mental health in Trinidad and Tobago, mental health services available, psychosocial rehabilitation, and we will explain that a little later. We'll ask Dr. Pierre to help us with that in terms of understanding that. And we'll also speak about some of the requirements for clinical supervision and mental health folks who are studying psychology, for those of you out there who are interested in or are studying psychology. So, gentlemen and doctors, thank you very much for being here.
Welcome.
Psychology Live. Dr. Dayal Singh, let me just start with you. A psychiatrist and secretary of the Association of Psychiatrists of Trinidad and Tobago. What exactly is psychiatry?
Psychiatry is really the study of any sort of emotional, mental illness that people may have. That you have to study that and actually go into the depths of it, what causes it, and also how do you treat it, the best ways that you can actually treat that.
Right.
Yeah.
I know one of the conflicts that we have in Trinidad in terms of the layman sometimes is the lack of distinction between psychiatry and psychology, right? And we hope to dispel some of that here or help to share with other folks. Dr. Pierre, what exactly is psychosocial rehabilitation? Let's start with that.
Yeah, psychosocial rehabilitation, as the name refers to, psycho refers to the brain, and social, how the individual adapts to changes in the society. Rehabilitation is concerned basically with the restoration of the level of functioning of an individual. Right. And this is with the objective of the individual returning back to the community and being able to adapt to changes in his or her actual community where he can function to his maximum level.
Right.
In this aspect, we use what is called modules, and we are concerned at this point in the teaching, learning, and training process of these individuals through the development and implementation of specific functional modules.
Right. Thank you. And Dr. Weller, in terms of, and Dr. Weller is at Mount Hope, as I said, and a supervisor in the clinical program, graduate program. He is also a former president, I should add, of the JAMPSych, Jamaican Psychology Society. I nearly said association again. So Dr. Weller, talk to us about psychology. Exactly what is psychology?
That's a very broad definition to give. But psychology is a study of behavior. And behavior is anybody's behavior, from a monkey's behavior to a human's behavior. It's a very broad field. The areas that people are most familiar with are the areas of counseling and clinical psychology, which are the areas that deal more with people's mental health and mental wellness, and to a certain extent, the applications such as educational and school psychology, industrial psychology in terms of organizational work, etc. So it's a very broad field, but in terms of mental health and mental wellness, I think that the areas that come to mind most are clinical psychology and counseling psychology.
Right. And of course, we also have quite a few school psychologists in the system in Trinidad and Tobago.
Yes.
Probably not as many as you would like to have. But Dr. Dayal Singh, to come back to you, what is and I know it's a broad question, but the state of mental health in Trinidad and Tobago?
Well, the state of mental health in Trinidad and Tobago, if you look at mental health, or mental illness or mental well-being, you're looking at mental illness and you're looking at certain factors and you want to see, okay, are we getting worse, are we getting better? But I would look at Trinidad and Tobago and also look at a global concept, because we're looking at, for instance, depression. It is found that the World Health Organization say by 2020, it will be the second highest cause of morbidity. So we're looking at that.
Globally?
Globally. So it's not just Trinidad. So people like to say, hey, Trinidad, there's a lot of problems, you know, this one not doing this, the government not doing that, blaming different institutions. But globally, we see mental health is a major issue. Even the World Health Organization in 2003 looked at alcohol as a problem. And they said about 2.3 million people die due to alcohol-related illnesses every year. So alcohol, again, is a problem. So we're looking at alcohol, we're looking at depression, we're looking at childhood disorders. We are seeing increasing. To get appointments to our child guidance clinic, it is 6 months, 12 months. So you're looking at that spectrum where you need greater input in children's mental well-being. Look at the other spectrum. Dementia is increasing because our aging population is also increasing. So we getting hit from both sides. So therefore, I would say we have to really make very good preparations to handle both extremes. And in the middle, you're always caught up with these people with problems, marriage problems, relationship issues.
All the stressors.
Which are going to come on with other illnesses. So it's not in a nice way. But thankfully, we have research globally telling us what we need to do. It's to get people like us and programs like us to get together and say, hey, let's start something, let's continue something, let's build on something.
Yeah. I know, Peter, you're very big in terms of networking of professionals. You want to talk to me some more about that in terms of
your ideas? But I think,
ideas?
as our colleague just said, I think one of the critical ways forward is for more collaboration and partnership. I think that as professional fields, psychiatry and psychology have been too far apart in terms of the way we operate on the ground. Clinical psychology in particular brings special skills, the assessment, the testing, the psychotherapy. We don't do the medication. That's the psychiatry realm. But I think that we all have to work together. So when Dr. Pierre was speaking about the importance of rehabilitation and re-entry into the system, I think it's really critical that we remember that mental health and wellness is a continuum, and that people who have anxiety problems, people who are dealing with grief in a protracted way that's causing them to be dysfunctional, those are all mental health issues. And those may not require medication, but they require intervention. So that we have to work together, because even if medication helps somebody initially, when they no longer need medication, they may still have a problem and need support. So there has got to be a coordinated and integrated approach. And I think the corollary of that is to say that our public, the consumer, needs to be aware of what they should ask for and what they deserve to get. Because it is only when you have pressure from the public that you get institutional kind of change. Sometimes that is required to really achieve the goals that we want to achieve.
So Dr. Pierre, talk to us about, continuing the psychosocial rehab and the services. What is available out there, and how can people access it? Just give us some landscape in terms of psychosocial rehab.
Yeah, sure. One important aspect that we have to take into consideration is that psychosocial rehabilitation utilizes an educational approach, where you have to teach the person certain skills. We developed a program at the Arima Rehabilitation Center, and there we were concerned with improving the lives of residents and at the same time to address the issues of persons who are not residents but have problems adapting to certain social norms and certain social situations, etc. So the rehab center, which we began our program in 2007 specifically, now had brought with it benefits to persons, because we did a research, a paper following the discharge of some of our patients,
Right.
and within the course of 2 years, 3 years, only 2 patients returned back to St. Anne's.
Relapsed,
No?
yes.
Relapsed,
Yes.
of course. So it shows us that rehabilitation with the educational approach, persons knowing about their illness, this is very important. No, you have to know about your illness, and in rehabilitation we treat the patient first, all right, and his diagnosis comes after.
Yes.
So we consider the educational approach as a form of treatment at the same time. The psychoeducational approach, both patient psychoeducation and at the same time family psychoeducation. And having said that, we developed a unit at St. Anne's Hospital, which is called the Psychosocial Rehabilitation Unit, where we have staff who work with us, and we have these staffs on different wards who are preparing patients for discharge.
Re-entry,
so,
yes.
re-entry back into the community.
Right.
So this is what we have offered. This is what we can offer at this point in time. And we really hope that rehabilitation can extend to the outpatient clinics, where a lot is needed there. The support that patients need, it's outside there. So what we have to do is to continue developing these programs to assist persons who suffer from mental illness.
Excellent. And with that kind of guidance, we shall take a break. The time seems to be running out very quickly on us. Welcome back to Psychology Live. We have as our guest here this afternoon Dr. Varma Dayal Singh, Secretary of the Psychiatric Association, and Dr. Stafford Peer, also a psychiatrist, and Dr. Peter Weller, who is a clinical psychologist based at Mount Hope. So we are continuing the conversation about the state of mental health and some of the psychosocial rehab issues that we treat with. And so let me ask you, Dr. Dayal Singh, in terms of the kinds of patients that you see, or out of the total population, what percentage would suffer from, and I know it's basically schizophrenia, but what are some of the issues and what are some of the kinds of folks that come in terms of the issues that they, yeah.
Generally, in populations, you may find 1% of the population may suffer from schizophrenia.
Yeah.
So when those patients, if they coexist in their own little world, in their own little homes, sometimes they stay there. It's when they start to act out and people get worried, see them, you know, they're talking to themselves, you know, they're thinking people are against them and they start to go after them. Then, you know, they bring them into St. Anne's to see us. So we are seeing these schizophrenics coming in, and we are seeing a lot of young people coming in with drug-induced psychosis. So drug is again a major issue.
Yeah.
So it's not just a health issue in terms of Ministry of Health, it's a multidisciplinary attack we need to go, because, you know, we may rehabilitate a drug, you know, somebody who comes in, send them to Cora, but when they go, the temptation is so easy to get drugs on the street. This is a problem we face. Yes. So you're seeing younger chaps coming in with this, you know, drug-induced psychosis, and again depression. We're seeing depression coming in. So we have these cases coming in. Yeah.
Are we talking basically marijuana or ganja or cocaine or harder drugs?
A mixture of marijuana, cocaine, and, you know, they have, like, they call it the black cigarette, where they take the marijuana and they put cocaine in it and sprinkle it.
Yes.
So some chaps come in now thinking, hey, you know, somebody spiked my marijuana with cocaine, not realizing it is the marijuana itself. You know, they are predisposed to schizophrenia. And by using the marijuana, that could also trigger the
Let me
the
put
attack.
you all on the spot here since this came up. You know where I'm going
I
already.
know where you're going already.
Yes. In terms of the legalization or decriminalization, at
Legalization.
least, which Jamaica has already done.
Done,
Decriminalize small amounts. What are your thoughts in terms of the legalization of marijuana eventually?
My grandparents told me when they used to plant their cocoa and they come home, they used to have a chillum and they used to pass it around in the among their neighbors, and they go and sleep. Just like our other cultures may have their brandy.
Right.
That was a limited amount. The THC levels in that is not high now. Now they're making high grade marijuana, kush, different types. So the level that we get in of the active ingredient is much higher now.
Yeah.
Plus, it's more abused. You find somebody who will smoke marijuana. Young guys may smoke in the morning, 10 o'clock, 12 o'clock. So it's not to say it's like just in the afternoon. It's a different scenario. Different in terms of, I think people are overusing it and there's a higher grade. Plus, and it's not like just taking it to go and sleep. They use it just to stay there.
Right.
And I'm seeing a lot
Recreational.
of young guys not being able to get out of that. So they are not interested in schools. And it shows now the university, tertiary education, male to female, two to
Two-thirds.
one. So if you find too many males are dropping behind. And if you just want to stay and smoke your marijuana and live in that little world and play your video games, we are losing young guys. Good. The other situation is other countries may have marijuana. They may have people tripping on the marijuana, but they will have systems in place to go and hold those patients, bring them in, and give them proper rehabilitation. And those people may go outside and not be bombarded by marijuana on all sides. So again, if we have the resources to deal with the fallout of marijuana, it may not be a problem.
Support systems.
Yeah, support systems. Yeah.
Let me just, before we move on in the conversation, 675-8747 and 675-8749 are our telephone numbers. Is also on the screen, so you can call in. Our lines are open in terms of connecting with our panelists. Dr. Pierre, your thoughts? You are the one that's dealing with a lot of the relapses and the sending people back out into the environment out there, preparing them for it.
Yes, well, may I say that my focus and my interest is not basically addiction rehabilitation. But to support what Dr. Dayal Singh has said, I would not prefer to support the legalization of marijuana. And I'll tell you why. Specifically, there's an age group that actually is involved in the use of marijuana. And we have seen in recent times, there's what is called a dual diagnosis. So persons may come with substance abuse psychosis. And the issue with the marijuana is that I would link the let's put it, fragmentation of the use of marijuana with nutrition. Persons who use the marijuana may not be in a proper frame of diet. So you would find that's my hypothesis, and that's what I think can be studied, the link between nutrition and marijuana. So I think that they are not well nourished, they are not well, their diet is catastrophic, and with the use of marijuana, would basically increase psychosis and cause social disturbances, etc. So I would refrain from supporting the
So we really
idea.
don't have the support systems, what I'm hearing,
That's right,
and the kind of whether it's community or other interventions to support folks who may want to indulge, like in other societies. Yeah, Dr. Weller, some thoughts?
Well, I fully agree that, I mean, as with any other substance that can be used or abused,
yes.
You cannot predict who is going to abuse, but you do know what the effects are, and we've seen it in our societies across the region. But I think, the piece that we also have to factor in is the damage that is done when people become criminalized because of use when they were not abusing and not causing a problem. And I don't think we've ever put a dollar cost in the Caribbean region of how many of our people, especially men, have been incarcerated, have had their records marred because of smoking one spliff or two spliffs or being caught. And that brings with it also the damage that is done to them psychologically by being imprisoned, etc. So it's a complex issue and not one that we can, solve right here and now. But I think the critical issue is that those who are preparing this legislation and those who are involved in making these policy decisions need to ensure that they have a balanced perspective on what will be required should they proceed with this decriminalization and legalization. And even if we don't have the resources to do everything that is required, we at least need to understand what should be in place and start putting those pieces in place, particularly for the vulnerable. We get back again to our adolescents and young people. And as I mentioned earlier, consumer awareness is a critical thing. I don't think many young people know, or many people know about the variations, for example, in the THC, in the quality of the ganja, and the fact that it can have varying effects. Many of them don't understand about their genetic potential predisposition, and that can be argued back and forth. But there's a large amount of psychoeducational work that needs to parallel any legal or decriminalization process as it takes place.
Yeah, and the other aspect of it, of course, is the cultural aspect. As you were saying, in terms of your parents and your grandparents. And so if you have a culture where it is, in some instances, more common than in others, right? And people basically grew up around it and so
never
on.
abused it, and it was just, go to bed after,
So like any consumer product out there is about managing it and having the systems in place. Okay. And so in terms of that kind of cultural sensitivity, what other kinds of, if I could ask you all, in terms of risk factors, are we talking about out there in terms of Trinidad and Tobago specifically, or the Caribbean?
Risk factors in terms of mental illness?
Yes.
Well, again...
Or wellness generally, or lack of wellness, yes.
You find that child abuse, sexual abuse, I mean, it's common. People try to sweep it under the carpets. There were studies that were done here, Tobago, elsewhere in the country, and we know it's there. I mean, there was a study that I think Daphne Phillips did, and she actually showed that the children who are violent in school, we say, why are you violent? And when we looked, 40% was sexual abuse of those violent. So when those guys are acting out and violent, things are happening. Sexual abuse, physical abuse, neglect. All these are things that can cause children to act out, either harm themselves, get suicidal tendency, violence, cutting, or end up in our clinic years after with some sort of, they may have panic attack, different sort of depressive illnesses. So we have to look from childhood, like if children are neglected, if they are the instances of sexual abuse. And thankfully with the children's authority, if or when it comes on board, hopefully it will take some of that slack. Poverty again is an issue because again you have poverty, you're trying to maintain your family, you're trying to get food on the table. That is a major cause of stress. Again, the food cards will help some, and the social intervention will help. Crime. We have patients in clinic. There's a lady who comes in. They shot her son 7 years ago, and then another son got shot 2 years ago. When she comes into the clinic, how could I heal her? Because the guy who shot them is walking up and down in their village. So this is the difficulty we have, crime, and you're coming in there. You have post-traumatic stress disorder, which is around 8%, I think. And it will go more if there are more crimes that people doesn't feel a sense of justice. So you have these issues that are occurring. So it's not just the drugs and alcohol; it's also poverty, crime, relationship issues. Infidelity, relationship issues that women may have problems dealing with. So there's a lot of issues we deal with on a day-to-day basis. Bullying in schools.
I'm a social organizational psychologist, and so I always try to let people know that a lot of these issues don't come out of a vacuum. They're coming out of the society that we live in, that we have created and cultivated. And so if we have young people falling through the cracks for all the variety of reasons and risk factors, then we need to look at the larger society. And community, which is also part of the solution, preparing people to go back into the community. Dr. Pierre, you want to speak some more to that? Yeah, and some of the things that you're doing at ARIMA and elsewhere?
Well, actually, the whole idea is based on education.
Right.
And what is essential is to have the facility updated where you can conduct some of your educational interventions, etc. So some of the clinics may be just adequate, others may just need a little bit of improvement per se. But staff is important to conduct some of these activities. Staffing is essential. And you see, what happens is I am of the view that you have to give someone who has been subject to let's say training in a specific area to conduct certain activities. No, and it's like I am of the view that you have to give the jacket to the tailor.
Yeah.
You understand?
Yeah.
You have to give the shoe to the shoemaker, and not every person trying to adapt or trying to be part of what they are not specifically trained in.
Right.
No?
Let me just interrupt you to take a call. Hello, caller. Are you there?
Okay.
Hello. Yes, go ahead.
Hello. If you're not sleeping well, could a psychologist help?
If you're not sleeping well,
Yes.
it depends on why you're not sleeping.
Another point.
Well, yes, I think that's a very important question, because you're speaking about something that is a fairly common phenomenon that people may not think of.
Actually, 6 days, 6 nights in the 1992, I didn't sleep at all.
So you was traumatized.
So you're saying that it may be partly a result of what you went through in the coup. You
Yes.
think that's related?
Yes. No
Well,
sleep,
certainly, if that is the
no
case,
eat,
then
no water.
if that is the case, then speaking to somebody who is professionally trained and can help you, who understands how trauma affects people, could certainly help you understand perhaps what is going on in your mind that is preventing you from relaxing and going to sleep.
Have you sought professional help at all, sir?
No. I thought about the giving tablets and tablets work for 1 day.
What did she say?
Go ahead.
She has a problem.
Yes,
Problem,
what
so,
happened,
yeah.
right?
Yeah, go ahead.
I do surgery for fibroids.
Fibroids.
Yes.
Okay.
3 years back, right? And just as how the same thing that when I sit down to clean up and thing, I just feel it, the same thing I feeling again.
That's a medical issue.
Yeah.
Yeah, well, that sounds like a medical issue, and you should go back to your doctor or to one of the health clinics for follow-up.
Uh-huh.
All right?
Okay, but that will help, that will for, like, if you know, like, if it can't go off properly.
Well, constipation could lead to a mass, which can give you the impression that there's still a fibroid there.
Right.
So if you're constipated, this could give you a
Right. So I
swollen,
suggest
yeah.
you follow up and either go to your community medical medical clinic, community health clinic, or to see your MD.
And do
All
an
right?
ultrasound. Ultrasound will rule out
Right.
any sort of growth like cysts that could also mimic a fibroid also.
Right.
Yeah.
Okay.
Yeah.
Okay then, thank you.
Thank you. Yes, Dr. Pierre, you were talking about yeah.
It is quite different in psychiatry as we would observe in rehabilitation. We know that, and we are aware of the fact that medication really reduces symptoms.
Right.
All right. But what we are concerned in rehabilitation is the teaching of social and independent living skills. Medication actually do not teach you skills.
It's a short term.
You understand?
Yes.
And what I think that it would be necessary is that, and I was speaking to Dr. Uella off the set, was that we need to increase, we need to develop curriculums at the different educational institutions that offer psychiatric rehabilitation or psychosocial rehabilitation, and not just look at the medication model or
Right.
the medical model to help solve some of these social issues, psychosocial issues that
Yeah, it's a multidisciplinary kind
That's
of
right.
response.
That's
Let me
really
take
right.
another call. Hello, caller. Good night. Hello.
Hi, good evening.
Hi, good evening. Go ahead.
About 3 years ago, I had a problem. My brother died, then my mother, she came and died, and I think that had a serious effect on me. For 1 month, I did not sleep at all. And then I went to the doctor. He told me I was suffering from mental stress. So he gave me some tablets, Babylon, and a little blue tablet. I forget the name right now. But that worked well. But that was 3 years ago. And I'm still having that problem. Not sleeping. Usually I feel sleepy if I'm sitting down or traveling. But from the time I reach in my bed, all the sleep goes away. And then sometimes, if I'm trying to sleep, I will just jump up and my heart starts racing, and then all that's it, the sleep will go.
Okay, hello caller. Are you getting treatment? Are you an outpatient clinic
No,
patient?
no.
So you need to follow up. You need to follow up in terms of some care, either with your doctor or in terms of your your health facility.
But, okay, health facility, that.
In your area, your neighborhood, yes.
And it's important for you to maybe consider that what you've been through with the loss in your family is affecting you physically, but it's also affecting you emotionally. And the grief, the anxiety, etc., will cause you to have difficulty sleeping or relaxing. And again, this is why it's so important that whether you go to your religious advisor, your imam or your chaplain, whether you talk to your best friend, whether you seek professional counseling, it is very important that you understand what is going on in your mind.
Because otherwise, what I'm trying to understand.
Exactly. But I think that we can't help you here in the way that you probably need help, because you probably need to have someone you can speak to regularly in order to really unpack and examine what's going on with you. What's happening with you is not anything so strange or bizarre. It's very normal to go through loss and grief and to have the symptoms you're having. But medication alone will probably not help. And so I would really encourage you to seek professional help. And as I said, that profession can be anyone from a trained individual who's coming from your religious faith-based organization, or a psychologist, a psychiatrist, a social worker. But the important thing is that you deserve to get the help you need, and we would want to encourage you to go out and seek it.
Okay, thank you.
Thank you, caller. Dr. Pierre, let me ask you this question based on what you've been saying in terms of the psychosocial rehabilitation. How have the communities in Trinidad and Tobago that you have engaged with responded to your patients, ex-patients, going back out into the community? Are we accepting, are we ready as Trinidad and Tobago?
The issue that we had here when we began the program is that it's unfortunate to say that many persons do not know what rehabilitation is. No? And I can even mention another word, recovery. That is very new to many persons. Even mental health professionals at the same time may find it a bit strange that, you may mention sometimes the term recovery. But that is what we are looking at. So the idea is awareness. The idea is initiate campaigns. The idea is to develop programs in the mental health and wellness clinics. That persons will become aware of the fact that anyone who suffers from mental illness can recover. Now, we should not confuse the term recovery with cure. Okay, and that expectation is a little bit beyond what can be expected. But cure, we have not discovered a cure as yet for particular disorders in psychiatry. But what we can do and what we have tried to do is to encourage rehabilitation to improve the level of functionability of individuals, which can lead to the minimization of some of these symptoms, and encourage and improve, and at the same time enhance their quality of life. Right. This is what we're looking for. So we need to promote more the concept of rehabilitation, and as I would consider, and as I said, we need to include rehabilitation subjects, seminars in the behavioral sciences. So you would have graduates coming out of these institutions with a knowledge of rehabilitation and begin to implement some of the techniques and the principles that rehabilitation carries with it.
Okay. Let us take another break, and we shall be back in a while to continue the conversation. Welcome back, Trinidad and Tobago, to Psychology Live, and we are speaking with Dr. Varma Dayal Singh, Dr. Stafford Peer, and Dr. Peter Weller, two psychiatrists and one psychologist, and we are talking about mental health, depression, psychosocial rehabilitation, and some of the challenges that we face in our very stressful life. Dr. Peer, just before we came back on, was talking about depression, and you want to continue that conversation in terms of the link between depression and other kinds of...
I was, within the last 2-3 weeks, I'm doing a study on the relationship between depression and diabetes. And of the persons who I have interviewed, the age group is very important here, because I unfortunately got a group that their ages ranges from 55 years to 80 years. Now, this age group, these persons, when I asked certain questions about what is depression, they were not able to explain what depression is. They did not understand depression. And do you know that one of the basic answers I got was depression is actually worries. No? So there's a lack of understanding. Probably they have been depressed. Probably they are in a period of dysthymia. No? But they cannot. What has occurred here was that the change of lifestyle, the change of diet have affected some of these individuals, which have a feedback on depressive symptoms.
So as they've gone through different life stages, or a change from one life stage to the next, you're saying that it's possible that may have helped the trigger, and they did not. Is that what I'm hearing?
What I'm getting from the study at this point in time is that having to change your lifestyle, having to change your diet, because it is not the same that you have been eating a lot of sweets and a lot of cakes and ice creams, and this one day for the next, you are informed that you are diabetic, and your whole lifestyle has to change. And I believe that here is where depressive symptoms steps in.
And that brings us to the issue of training that we talked about. Dr. Weller, what's happening at Mount Hope and or generally in terms of what kind of training should we be engaging in to prepare our students, young psychologists, and also current psychologists in the field in terms of dealing with a lot of these stressful...
All right, let me respond first by piggybacking on what was just said before. I think that when we think about education around mental health, the people who need to be educated most is the public. We had a call a while ago, and Dr. Peer just used an example of individuals who didn't even understand what depression was. They didn't even understand that there was a link between their emotional health and their physical well-being. So many people have stress headaches, and they don't understand that it's a headache from stress. So they're popping pills to stop the pain, when in fact the stomachache is stress-related. That is all part of mental health, and we have a very important role to educate the public in that regard. Now, with regard to educating our providers or professionals, whether psychiatrists, clinical psychologists, clinical social workers, I think it's really critical that the kind of grand scheme that we're talking about, where there are multiple services with multiple providers, mean that these providers have to have the skills. And those skills are not just book learnt. We have to be very careful, therefore, that the training includes, because we're moving towards the use of technology, and there can be a lot of online training and modules taught online, but that's theory, that's facts. When it comes to the interpersonal skills, when it comes to the ability to create rapport, to engage somebody in sharing information that perhaps is very sensitive, they've never talked about before, or they're not even aware, that kind of training requires close clinical supervision. And I think if there's one thing that I feel very strongly about, it is that our mental health professionals need far more training in clinical skills supervised by professionals who have had their own training in order to ensure that when they go in to help somebody, they do help and they don't harm. The analogy I always use is that if somebody shoots you in the head, Keith, I can take out the bullet. Your head is relatively small. I could find that bullet. That doesn't make me a neurosurgeon.
Right. Yeah.
Talking to somebody who has a problem, I could get them to bawl and cry and tell me what their father did or their mother did. That doesn't make me therapeutic. And there are critical skills that we have to learn to move beyond just the ability to provide. Social support is one thing, but if you're trying to transform, if you're trying to change, you really need to understand it as a process, and that process means a certain type of training that requires certain types of trainers who themselves must have been through that process. And I think that it is something that we together as professionals really have to collaborate to ensure takes place.
Well, I couldn't agree with you more, as a part-time and former full-time educator also. Because I think we're concentrating so much on the piece of paper, the alphabet soup, without the interpersonal and the introspective skills, as I like to call it, in terms of what you present to your patients and your clients. Given our diversity here, class and ethnicity and religion and all those kinds of things. So, again, the conversation is saying that we need to prepare our young professionals. We need to have, what about, and I come from an environment where I was trained in the States where, of course, peer review and peer kinds of support are critical. Does that happen here in Trinidad and Tobago? If not, should it happen here? In terms of lifting the skills, in terms of sharing, in terms of consulting, co-consulting, etc.
Peer supervision, in other words.
Yes, the whole works. Is it happening here? Should it happen here?
Well, I can, as I've been here 7 years now, and I'm only just beginning to start private practice. Previously, I didn't. But I do know that a number of my psychologist colleagues have set up their own small groups, which they meet regularly and share concerns, information, get feedback from each other about how to handle difficult cases, etc. And I think that is critical because none of us is perfect.
Right.
And we can do a lot of harm if, as a mental health professional, we're not keeping ourselves healthy. And one way to do that is to be part of some kind of supervision space where you can learn from each other. Now, I don't know how much of that happens with psychiatry. I can't speak to that.
Right.
Well, somebody may have a patient going to a particular psychiatrist, not getting good results, and they will go to another colleague. Usually cases like that, the colleague may compare notes, share notes. What is the better drug that you could use? What have been used before? So you may have that going on a level like that. But in terms of actually having like a group practice where you look at which psychiatrists may be sub-specialized. I mean, there's a forensic psychiatrist where, we wouldn't venture there, where we give them anything to do in the court. There may be 2 psychiatrists who probably did hypnotherapy, which is I think Dr. Malamaraj and Dr. Bisesa. So sometimes you may have cases where you may say, let's send to these. Dr. Babulal has an interest in dementia. So she has a memory clinic in Mount. So sometimes you see a patient and say, hey, you'll do better that way. You'll do better that way. So we will send to our
Let me take a quick break before we get back to our last segment. Welcome back to our final segment of Psychology Live. Let me remind you again that we are taking calls and our numbers are 675-8747 and 675-8749. And you can also follow us streaming live, right? And we are on Facebook, our TV4, #Psychology Live, our Twitter feed. So, given the hour that we have, it's always very difficult to touch on so many different topics. And I'm not sure that we have a sense, given all the stresses that we are engaging in modern life, especially with technology, We had a show with some young people when you were talking about social media and that whole influence in terms of the likes and putting themselves out there and the transparency and exposure and so on and so on. And I know that I have personal experience of young people who have fallen prey to the technology in terms of the addiction and addictive personalities to technology. Is this an issue at all in terms of psychiatry in Trinidad and Tobago? The kinds of patients, in other words, what are the trends, some of the trends that you're seeing?
Well, the
general. I know you've talked about the substance abuse and the schizoid behavior, but what other trends are we finding out there in terms of mental health issues?
The gaming, I see. Gaming. You have young children gaming. Some of them gaming. They want to have gaming, getting addicted to the games. You have, so the parents will come to complain. My son is locked up. 8 hours in a room, he just comes out, eats, hardly any word goes back. So that person would not learn how to socialize, wouldn't know how to read faces, how to interact. That person could come out in society and cause problems later on. So you have that aspect of gaming causing it. You have the young girls, taking shots of themselves, and this is the selfies, and this is the way now they. But times are changing, so you find this whole idea is changing, and sometimes they don't know the danger, what they may be doing. It may come back to hit them a few years in the future. So you have these occupying the minds of the children and the time. And again, it's how do they curb this time? How could they use this tool, which could be useful in some cases, into a period of time where they can say, I'm not going to spend so much time in it. So it's really a matter of discipline to teach them. And sometimes some adults get hooked into it. So it's difficult. So you remember a child now growing up, you have to accept certain rules, certain guidelines. Say you're going to stay there for a particular amount of time.
Yes.
Yeah, I think that on the basis of these psychosocial issues, I think that parenting plays a very important role in the development of a child, a youth, and an adolescent, and there may be neglect. There may be, at this point in time, allow the child to do what he or she may be considered pleasurable, etc. And it's like a kite that is high-in this sense of the word. So I think parenting is lacking in our society, and parents need to get back and take the mantle of the care and education that they give to their children. And there are a lot of I have heard there's quite a few programs on parenting, etc. But we need to encourage more the population to participate in these issues, these programs, and to realize that we are actually faltering in our parenting skills, and let's see how we can redirect society, the society of tomorrow. What I'm referring to, no?
Right.
There are often courses, I think, in parenting. I think they have started. I don't remember which ministry. Social development has started parenting, trying to teach them. But the problem is single parents.
But that's another
issue. For a home without a father, and even teenage pregnancies. I mean, 2,500 teenage pregnancy in a year. These teenagers now cannot even, they're not growing up. How could they manage a child? So all these issues we need to address.
Well, as I was saying earlier, it's in a society that is becoming more and more technologically driven, right? We seem to be losing our interpersonal communication skills. The parents are out there, single or otherwise, right, trying to earn a dollar because we have become very materialist-based, kind of society. And a lot of the interpersonal communication skills, and of course the technology is babysitting or teenage sitting the children, with all the fallout in terms of antisocial behavior. So what are some of the issues or recommendations that you would make to parents out there in terms of handling and coping and managing? Let me take a call first before we move on. Hello, caller. Good night.
Yes, good night. I have a question.
Go ahead.
Yes. One of the things I've found is that as a professional, I've found that sometimes there is no nexus between the branches. For example, if you're working with as a psychotherapist and you have a client and you refer the client probably to your GP, to a GP, and you're expecting that you have given a short history of the patient and what went on, that the appropriate medication would be given, and so on. And even some psychiatrists, you would try to pass this on, the information on, and you get an idea that there's failure to connect with the psychotherapist. It's as though there's no training that, so between the branches, to trust the psychologist or the psychotherapist.
You're speaking.
And then
Hello, caller. Hello.
Yes.
You're speaking as a psychotherapist.
Yes.
Okay,
I am.
I see.
Yes. And it seems that there's no trust, or the people who are not trained to understand each other and to move forward.
Okay, all right.
And some of that is lacking. I'd like to hear the response, please.
Thank you. Let me take another call before we go to that. Hello, caller. Good night. Go ahead. Hello.
Hello.
Yes.
Hi, are you hearing?
Yes, I'm hearing you. Go ahead, please.
Okay, my question is starting recently. My son is 21 years old, and I had to take him into the St. Anne's. So the diagnosis they had given is delusion disorder. How do I deal with it?
What disorder?
Delusion.
Delusion.
Or schizophrenia?
Okay. All right. Thank you. All right. So we have 2 minutes. Anybody wants to respond to the last question first? Delusion disorder, and she wants to find out how she deals with it. I gather. I wasn't hearing too well.
Well, a delusional disorder could be a delusional disorder where this child has false beliefs, so actually they are believing things that is not true, people after them, and it could be a delusional disorder by itself, or it could be schizophrenia, or it could be drug-induced also. So when you're in St. Anne's, usually they would do a drug test then to make sure it's not drug-induced delusional disorder. Other than that, we'll now think it's probably a chemical imbalance in the brain that is causing these false beliefs, and then we try to use the adequate medication that could actually help alleviate these symptoms.
I think also what she's asking is what she should do.
Oh,
and I think it speaks to the issue that Dr. Pierre brought up earlier, that I would hope the caller would be able to contact Dr. Pierre at St. Anne's and ask about the support
system,
the psychoeducational, because that's critical. I think it must be very challenging for her to have her loved one change so dramatically and not be sure how to help. So I think that the starting point would be for her to contact St. Anne and find and get some education herself.
Right. And this reinforces the importance of family psychoeducation, because most likely I am of the opinion that this lady, she got a diagnosis of a son, but that's it. No, she has to be taught about the illness.
The re-education now.
Re-educate her about the illness, and that can improve the relationship.
Can we deal with the first question now in terms of the different professions and the co-managing of patients?
I think the caller was use the word trust, and I think that is the issue we have to start with. To build trust, you have to have a relationship and have knowledge and have exposure and experience. I don't think in the Caribbean overall, psychiatrists and psychologists of the many types of psychologists that they are have had much time together to develop a common bond of trust. Part of the challenge is that, unfortunately, within the realm of psychology, there are many practitioners with many types of training, and the public doesn't understand the difference between who is a clinical psychologist, who is a counseling, what's the difference in competences with somebody who only has a bachelor's degree in psychology versus a master's versus a PhD. And a lot of terminology is used, therapist, counselor, psychologist, etc., which is not clearly defined because we don't have the kind of certification that we should have as psychologists. So 2 points I'm making. I think that these kinds of discussions, as we are having here, and any fora that can be created where psychologists and psychiatrists can come together and share, will be a critical step in that direction, that we'll understand and trust each other. But within the field of psychology, the public needs to understand that not everybody who calls themselves a therapist or a counselor has the same degree of competency and skill and training. And we have to monitor ourselves, but the public has to also be aware of what they're seeking.
Unfortunately, we have run out of time. 1 hour has gone by. Thank you very much, gentlemen, Dr. Dayal Singh, Dr. Pierre, and Dr. Weller, for spending the hour with us on Psychology Live. And look for us next week when we will talk about preparing parents and students for the exams that are coming upon us next month and all the stress and anxiety that comes with it. Until next week, take care of yourselves.